Bloodletting and sorcery, the horrors of medieval medicine. Medieval medicine is not a story of progress, but a chronicle of suffering. It was an era when physicians relied more on stars, prayers, and imagined bodily fluids than on logic, observation, or hygiene. This was a time when people were healed with prayers, maimed by leeches, and killed in the name of treatment. In this article, we will explore the nightmarish reality of medieval medicine, as it truly was, dark, filthy, and merciless. Diagnosis without knowledge, urine charts and horoscopes. Medical diagnosis in the Middle Ages resembled shamanism more than science. Physicians often diagnosed illnesses based on the color and smell of urine, the appearance of the tongue, or the alignment of the stars. Patients' urine would be brought in bottles, and doctors could make diagnoses without even seeing the person. Horoscopes were used to determine the critical days of illness. There were no microscopes, blood tests, or X-rays, only assumptions and superstitions. People died from pneumonia misdiagnosed as an excess of black bile. The humor theory, for elements within the body. Medical theory was rooted in the ancient concept of the four humors: blood, yellow bile, black bile, and phlegm. Illness was believed to result from their imbalance. Treatments aimed at restoring balance through bloodletting, emetics, and laxatives. If a patient looked pale and weak, they were bled. If they had stomach pain, they were given an emetic or enema. These procedures did not heal, they worsened the condition. Weak bodies lost strength and often failed to survive. Bloodletting, a popular way to die. Bloodletting was a universal cure-all. It was performed using knives, leeches, or special cupping devices. Sometimes up to 500 milliliters of blood was removed, and repeated sessions simply overwhelmed the body. Even more horrifying, doctors applied bloodletting to pregnant women, children, and the elderly. People bled under medical supervision and died not from disease, but from the treatment itself. Leeches, living tools of healing. Leeches were attached to the neck, abdomen, genitals, anywhere imaginable. They were believed to purify the blood and remove excess humors. But instead of healing, infections often followed. Leeches tore skin, left open wounds vulnerable to dirt and bacteria. Repeated treatments led to anemia and fainting. For the weak and malnourished, it was often a death sentence. Surgery without anesthesia or antiseptics. Operations were performed live, without anesthesia. Healers used knives, saws, and red-hot irons. During amputations, patients screamed in pain, fainted, and died from infections. Instruments were neither sterilized nor washed. They were placed on dirty tables and reused. Post-operative bandages were made from dusty rags. Mortality rates reached up to 80%. Herbal remedies and magic, the thin line between doctor and sorcerer. Herbalists treated patients with tinctures and ointments, often more effectively than licensed physicians. Yet they were easily accused of witchcraft. Women who healed with plants were called witches. Even knowledge of antiseptics, like garlic or honey, raised suspicion. Too effective? Must be devil's work. Mental illness, demons, exorcisms, and chains. Melancholy, epilepsy, schizophrenia were explained as demonic possession. Treatment included prayers, exorcisms, beatings, confinement in monasteries or chains. The mentally ill could be burned as witches or kept in dungeons without food or water. Only a few monks attempted any humane care. Childbirth, death as the norm. Women gave birth at home, without professional help. Midwives worked by intuition alone. Instruments were unclean. In case of complications, caesarean sections were only performed after the mother's death, to save the infant. Maternal mortality reached 30%. Infections, hemorrhage, placenta retention, all were death sentences. Infant mortality was as high as 50%. Hospitals, holy shelters for the dying. Medieval hospitals didn't heal, they received the dying. They were monasteries where the sick were laid side by side, waiting for death. Hygiene was non-existent. Blood, pus, stench filled the air. Sometimes dozens of corpses lay in one room. One chamber pot served many. No separation between diseases, infected patients were mixed together. Comparison with modern times, from torture chamber to hospital room. Modern medicine is the result of millennia of struggle for knowledge. Today we have anesthesia, antiseptics, surgical standards, psychiatric clinics, perinatal centers. Medieval medicine was a mix of ignorance, fear, superstition, and pain. Every visit to a physician could be your last. People feared treatment more than the illness itself.